How would you distinguish between the work you were getting from the speech pathologist and what the neuropsychologist was doing for you?
Those seemed really close. The speech pathologist worked with me more directly on like the English language and the use of English language and the use of talking and conversation and understanding people, where neuropsychology I developed and I shared more private things, more social things.
So it would be more of a counseling type session than a specific...
Yes, than a specific therapy.
Can you explain that at all?
Well, I can, as far as neuropsychology goes, there was a time, I want to try to give you a timeline. So, this is kind of, well, if this isn't good, you tell me. I went from my parents' home back to my apartment with a roommate. And then that was for about a year, and then I moved into an apartment with my boyfriend who became my fiance, and then we got married. And when I moved into that apartment with my fiance, that was in 1988, so that was 2 years post. I remember having a counseling kind of session with my neuropsychologist at the time, and I distinctly remember talking to Dr. Yanni about my fiance. I remember saying that I was uncomfortable with my fiance talking to any other women, that it bothered me. And I remember Dr. Yanni saying that, I remember that I kept saying that I was always asking my fiance, are you cheating on me? Are you seeing other women? Are you cheating on me? Are you blah, blah, blah? And I remember my neuropsychologist tell me, if you keep asking him that, he's gonna. That's a specific counseling kind of time with neuropsychology.